I'm Dr. Jim Powell. I practice chiropractic in Canton, Ohio for over 45 years. Our office used a system, a tool in practice that helped our patients understand the more holistic approach that our office has to patient care. In our office, we make every effort to do whole person care, but so many patients come in with musculoskeletal issues, not knowing what all you can do to help them with other health issues they may be dealing with. So this is a great way to introduce the patient to more of a whole person care philosophy. It's called the 7 Essentials to Health and Well-Being. And what it is, we put together, standard process in Powell Chiropractic, put together a booklet to help your patients understand all that you do for patient education, but also almost like the Oswestry program for musculoskeletal issues, to grade where they stand in each one of these 7 essentials or primary functions of the body that are critical to enjoying better health. There are 7 Essentials to Health and Well-Being is the name of the booklet. It also has in there product suggestion, especially for new doctors to standard process who are unfamiliar with the complexity of many of the products that we have. But it's only suggestions, so they can be altered and changed according to your knowledge of the products or your personal experience. But when a patient evaluates where they stand in each one of these essentials, it becomes evident and clear to them and to the office what other concomitant or other issues they may have other than the chief complaint that brought them into your office. The 7 essentials that we have developed are, number one, is the structure of the body affects its function. That's chiropractic, and that can be as complicated and specific as your office philosophy is, or it can be as general as whole person care. But what we want them to know is that the structure of the body does, in fact, affect its function, and there are certain nutritional support products that are available to help them with those musculoskeletal issues. Number 2 is what you eat and what you drink. And we all know that we should eat better, we should eat real food, whole food, and we should avoid foods that are harmful to us. And most of us know that, but it's having the discipline or the commitment to make that change. So this is encouraging the patient who has an unhealthy diet to change their lifestyle and improve their health by improving their diet. 2 is drinking, water especially, because a lot of people drink soda and other beverages to quench their thirst, but in reality, pure, clean water is an essential to your health and well-being. Next is, the third, is digestion. Most all nutritional health issues start with digestion. And it's not just digesting, it's also assimilating what you do digest, and then eliminating the waste products that your body can't use to function in your body correctly. So digestion begins in the mouth. It's chewing their food properly, having the correct enzymes to break down the food, but also, is the food digestible? There's so many different products on the market to deal with the symptom of indigestion, and part of it is because Americans eat so many foods that are not digestible. As a result of that, they become nutritionally deprived. Very critical to health and well-being is digestion. The next essential is a balanced endocrine system. The endocrine system can be complicated, as most of you know, and patients don't realize in most cases that you can offer something for them to support endocrine issues in the whole variety of problems, especially female issues. So many health-related issues women have dealings with is because of an imbalanced endocrine system. But that's a critical essential that I believe patients have when they come in with that musculoskeletal issue that they don't share unless you do an in-depth consultation. The next essential is exercise. Of course, we all know we should exercise. And some people feel that if they don't belong to the gym or they don't exercise or work out an hour or so every day, then why bother? Well, we have a different philosophy on that. And what I've learned over the years is we encourage patients, if 5 minutes is all you can do, then 5 minutes is good. You've got to keep the body moving for many, many reasons, and for musculoskeletal issues primarily. So the 7 essentials tie into all the issues that provide better health and well-being for people. The sixth is called managing your stress. And everyone deals with stress. So many people think stress is purely emotional. And for the most part, it's an issue, a big problem that most of us have. Balancing the budget, raising family, watching the news is stressful emotionally. But there are physical stresses on the body that cause other problems. And there are, of course, nutritional stresses. And the stresses, I believe, that most people get nutritionally is not just because they're nutritionally deprived. It's from the insult of the foods or artificial foods and chemicals they're taking in their diet that they may not be aware of. And the last, or the seventh essential, is what you think about. It's pretty hard to have a positive life when you have a negative attitude. And so we put this all together so the patient will recognize their entire system, complicated, but yet usually dealing with other issues other than just their chief complaint. And for the doctor who is new to standard process, it gives product suggestion, gives the patient an educational perspective of chiropractic as a whole person care profession and not just dealing with musculoskeletal issues, which is very important to me. And I've spent my entire lifetime educating patients, and it's still troublesome that we are still misunderstood. So if we can, standard process and myself, if we can help you in your office to educate your patients more completely so that they understand the full concept of the care that we offer, this will be a great success. So we're incorporating this into a program, which I think you'll be very proud to have in your office. It'll be something that you'll enjoy giving to patients. It'll fit into the system that you're currently using. It's not starting a whole new system. But if you're interested in becoming a more involved standard process customer, we are here to help you do that. We know the products that we have should be in the hands of so many people, and the only way we're going to get it through is through healthcare professionals like yourself. So the more you know about helping people through whole food nutrition and through chiropractic, lifestyle changes, exercise, movement, and education means an awful lot to the standard process family.